Yeah. The thing I wrote on Twitter that week, one of my realizations, and I'm making an assumption about these people, but I feel free because these people have made a number of egregious assumptions about us, is that stigma is so bound to insecurity.
Fear.
Fear,
Stigma
and fear
and fear go
and
hand
insecurity,
in hand.
insecurities in there too.
Yeah.
And it gets projected outwardly.
It does. Yeah.
It's an outward projection of their own fear or insecurity. And that fear may be around their own mental health or their own experience with substance use, or their parents that they were never able to say, and the family member, whoever that may be. But I just would maybe take a swing at the fact that a lot of them, it's, well, my parent drank and I could never say anything, and it gets tangled up and internalized and then projected out as hate, as negativity, and really toxic, venomous stuff.
Yeah. Yeah, it sure does.
And then it gets politicized and it gets made into something even more powerful, which is what can get really, I think, scary in our, in terms of changing policy and influencing, drug policy, public policy, stuff about housing. You could just draw a long line of issues that are connected to that.
Mm-hmm. Well, this is go ahead.
Sorry, go ahead.
I was just going to say that's kind of the crux of the whole thing in Western culture right now, right? Is this politicians, especially populist, thank you. Ones who are using, directly using fear to motivate their base, solidify their base, and then sometimes pull disgruntled members away from their party. Like Pierre Poilievre, his statement about children getting diverted, hydromorph.
Yeah.
He knows that that's not true.
Yeah.
His handlers know it's not true. And it's such a low level grab. And it's just, I look at that and I think, really, we're still doing this type of shit after everything we've seen and everything we've been through. I mean, I get it. It's low hanging fruit and it works. I unfortunately it works. So you almost can't blame them. But at the same time, if you're going to go for a leadership position like that, you'd hope that somebody would be a little more responsible with the truth. But it's never going to happen.
It's such a display of small and narrow-mindedness.
Yeah. And is it necessary? That's the other thing is, in his case, I don't think it's even necessary.
No.
His base is his base. He's got them. You don't need to convince them. They're already convinced that what we're doing is insane.
Yeah.
So it's not like you're going to move the needle there. I don't know. It's a strange thing.
Yeah.
But the people who are making those type of comments that are fear-based, that's their bread and butter.
Yes. Yeah. And your dad was actually helpful in what he said to us, was that this is actually what you and I were trying to get across, is to kind of tie up everything that we're discussing, is that at least we're alive, and express some gratitude for being alive, and that the individuals who have a safe supply, whatever that may be, and a safe supply can look like a number of things in our province, including if you're diverting it from the workplace, you're still alive. You still have the opportunity to recover, to work on your mental health, to live.
Mm-hmm.
And
it's a very important point that you made there. And it really resonated with a lot of people. Your point about nurses having access to a safe supply, or healthcare professionals having access.
Yeah.
It's a good way for people to look at it. And you don't see stats for nurses dying. And it's not that is, concrete evidence in itself, but it does give people a little bit of a framework to start to understand what the point of this is.
Yeah. And if you are of the mind that would look at that statement and say, he's condoning drug theft and intoxication at work for nurses, then I feel sorry for you.
Right. Yeah. Yeah. It's missing the point a little bit there for sure.
Yeah.
I guess the other thing that maybe we thought we'd touch on here is some of the issues that would be confusing to people, or I mean, really one of the things that I thought would be useful is if we do spend some time at some point here and put together just a kind of a very digestible piece on how Safe Supply is working right now. You know, what is being offered and what's some of the problems, what's some of the pros and cons with what's happening now, what we're seeing so far with the evidence, what we're hoping to see in the future, that kind of thing. So to help kind of, because sometimes I think we get caught up and we talk like everybody understands exactly what Safe Supply is, and many people I think could use a little more information as to what Safe Supply is and what the goal of Safe Supply is. So at some point I'd like to do that. For now, there's a couple things that there's some real concerns, I guess, and one of them is diversion. So what we mean by diversion is when we're giving out, let's say hydromorph is a good example. If we're giving out hydromorph for people to use on their own, and that sometimes could be with their opiate agonist therapies, like say they're on methadone or some other kind of stabilizing sort of long-acting formula that's meant to prevent withdrawal and help stabilize their life that way. And then the idea would be to give them a safe supply of something they can use instead of toxic drugs so that they're not at risk of overdosing. Now, some people say, like what Pierre was alluding to there, is that by providing these like hydromorph tablets, for example, to people, they're going to take them and then they're going to sell them, or they're going to give them out, or in other words, they're going to be diverted away from that person and they're going to go elsewhere into the streets or whatever. Now, this is something that is going to happen. It's something that is going to be an inherent risk of this program. And what we would be looking for here is an increase in deaths from hydromorph alone. Yeah. If we saw that would be an indicator that the program would be having a negative effect, because right now the vast majority of deaths that we're seeing in this crisis are from products that contain fentanyl. It can be there can be tons of different drugs in there, but it's fentanyl that is killing people. So if we saw somebody who is just using a pharmaceutical grade dilaudid or hydromorph, and we saw people dying from that would be an indication that we would be contributing to the problem instead of alleviating the problem. Right. We have not seen any indicators yet that is happening. No. So it's either too early to tell because the program is too small, or it's not a problem yet. But that would be a concern. And people are like, well, if there's more, like the price has been driven down tenfold now, which is good. That's what we want. Mm-hmm. So now instead of $10 for, I think it was $10 for an 8 milligram tab of dilaudid, it's now $1. So at that price reduction, it almost doesn't make sense to, like, people are just, I think what that indicates to me, at least, is that people are for the most part using their safe supply like they're supposed to be using it.
Yeah.
Because and that's what we are trying to do to prevent the death. So that's a good indication. And the other thing that does, of course, is it kicks legs out from people who are dealing shit drugs. Right? Yeah. You've got this stuff out there. Well, do I have to? And I'm in a real bind here, and all I can get is fentanyl. Well, no, you don't have to use fentanyl. Here, have a couple of mine.
Yeah.
And Garth has talked about that often. How sharing has saved him from having to, go to shitty supply. And I think that's the case. I mean, I would speculate that that's the case for a lot of people, but we don't know.
Yeah. The other pin to put in that whole argument is taking a look at underage drunk driving deaths in our country, because alcohol is sold as a safe supply. It is a controlled, safe supply of alcohol in our country. And any minor who cannot go into a store and buy that alcohol for themselves is getting it either by diverting it from their, adult family member supply, or they have an adult who's buying it for them.
Right.